Welcome to GovCast. I'm your host, Jordan McDonald. Today, I'm talking to Ben Williams and Indra Sandal at VA about the VHA Uber Health Connect initiative. This episode is brought to you by IBM and V3 Gate. Are you ready to transform the way healthcare is delivered? Meet IBM Watson X platform, the cutting-edge AI solution that's reshaping the landscape of federal healthcare. V3 Gate, in partnership with IBM, empowers federal healthcare agencies to enhance patient outcomes, streamline administrative processes, and leverage advanced data analytics. Imagine reducing wait times for veterans and active duty personnel and enabling data-driven decision-making that puts patients first. Let's make a difference together. Embrace the future of healthcare with IBM Watson and V3 Gate. Learn more at v3gate.com. We are here to talk about the Uber Health Connect program, which launched in 2022 at what was initially just 10 sites. Now, I understand that the program is being rolled out across the enterprise, and I sort of wanted to just circle back and see where we are now that the program is now fully deployed. Indra, could you tell us a little bit more about the program? Just a little bit, because we've talked about it so much before. But how's it been over the past year since we've last spoken about it, and now that the program is rolled out to the whole enterprise?
Yeah, thank you, Jordan. And very happy to be on your podcast because this is a wrap up of the VHA Uber Health Connect initiative. We did start with you when we launched it in 2022 to 10 VA hospital. And if the audience are listening this first time, this is a VHA Uber Health Connect initiative. If you want to know more, go to their first two podcasts, and this is the third in series for the GovCIO. So we started this program considering how we can improve and decrease the missed appointments and increase veteran experience and also do the cost saving and targeting on the largest barrier to the access to care to the veterans for the transportation. So in January 2022, we piloted this program in 10 VA hospitals in Vision 9 and Vision 15. And after a successful a pilot of this program in 10 VA hospitals in two Vision. In April 2023, we deployed this program to 58 more VA hospitals in 7 more Vision and to see that how it will work. So that was the second phase of the pilot. And this year, in April 2024, we wrapped up the pilot and optimized the process. And moving forward from the May 1st, Veteran Transportation Program Office took this program under their wings, and they are deploying it enterprise-wide. So as we talk, by end of this month, this program will be available in 100 VA hospitals. So I will let Ben to talk a little bit that how it is going on that other side after the wrap up of the pilot in May 1st. In only a few months, it deployed in 26 more VA hospitals.
Yeah, thanks, Indra. A great recap of the road we've been on, or road we've been paving for the last couple of years, and very excited about continuing and working to sustain the progress that's been made. As you mentioned, we've deployed at 2026. I think it's going to be 101. I might fact check you a little bit there since we're in that season of fact checking. So I think we're going to be at 101. And one of the great things too, as we continue to roll out, we're continuing to work with all the facilities and network directors to help them understand, even if they don't think necessarily they're in an urban center that might use a lot of rideshare or have a big rideshare network. Even a lot of the smaller networks and some of the smaller sites can really benefit from having this as part of this particular process, as part of their toolkit. And even if they're, the pilot, as you mentioned, was Uber Health was our collaborating vendor. We're now part of that mix is Lyft and other rideshare providers. So it is a vendor agnostic process that, depending on the market share, or if facilities want to activate more than one the rideshare providers. They can do that as well. So we're working with the facilities and continuing as we activate the ones that are readily in line. We're working with the other facilities to continue to help them and their leadership understand how this can be a great process to have just as an option if veterans need this type of transportation. So I think you did a great job recapping kind of where we've come from, where we're at, and we're going to continue to push until this is enterprise-wide, truly enterprise-wide and active at every site for veterans who enjoy and are eligible for this type of transportation.
Can I ask over the past year, where are you seeing veterans using the service the most? And I guess how many of those veterans are using the service since it's been rolled out?
So I do have some numbers, Ben, if you have. So at this time, around 50,000 unique veterans. So each veteran takes so many rides. So, but we don't consider that many rides, but it's a person. So till now, 50,000 unique veterans already use this service. And also till now, around 450,000 rides are completed. So in last 1 year, in March, when we wrapped up the phase 2, it was 263,000, but only in 4 months, around more than 200,000 is added. So at this time, we have overall 463,000 rides are completed by 50,000 unique veterans, and around 6 million miles are traveled by the Uber and now also the Lyft in it.
Indra, you mentioned the last time that you spoke with GovCIO about the money being saved here. It was in the millions even as far as back as a year ago, but where are we looking now? How much money has this saved in terms of costs for veterans and healthcare costs overall?
So I will let Ben to talk more about it, how they are looking at it now from the enterprise side. But we do have a data started from January 2022 till our March 31st, 2024, that how much cost saving was done. It was around 200 million, and that is based on around 15,000 inpatient discharges where the cost saving was done. And around, let's see, what was the number? Around 142,000 no-shows and missed appointments was avoided. So that was a cost avoidance and the cost saving from the discharges, which was done till almost like till May 31st, 2024. And I will let Ben to talk about that, how they are now integrating the automated system in the whole system, that how the Uber Health dashboard can be integrated with their vet ride. And they are doing in a technology side that how they are going to calculate the cost also. So I will let Ben to talk about it.
Thanks, Indra. So we have made some transitions. So we learned a lot during the 2 pilot phases, right? And part of it was on the intake side when we receive ride requests and we do the eligibility check for that, and then move into the scheduling part where we offer the ride or facilitate the ride connection for the veteran. We have moved as we moved into sustainment and added the other vendors into the mix. We've also transitioned the intake part of the process. So that's where the veteran basically calls the facility or tells the facility when they're scheduled, hey, I don't have a ride, I need a ride. So we have a very streamlined way now. It was done with the best tools that we had available during the pilot. We've made some advancements on the vet ride side, which is the application that we use to schedule our in-house transportation. But that's been since integrated with MPI. So we have all the veteran profiles that has all the addresses. And so it makes it very, very simple to pull a veteran up, find with the originating location, which is typically their residential address, and then point them to where the appointment address is and get that ride scheduled without going into a different system. So we've been making those changes as we've been rolling out to the additional and activating at the additional sites. So that's a big change since the pilot concluded. We're also changing our data and reporting because we are working with multiple vendors now, so I don't have an updated total cost savings for you. We're going to have that calculated for the end of the fiscal year, and have all of that in place as we move forward. So I can take that as a due out to get back with you. Maybe we can append it to the transcript or something of the podcast, and folks can reference that. But one of the other things that we noted as a marked difference, and even though the pilot had tremendous success in the number of trips that were able to be completed and things, as Indra mentioned, because we have a more streamlined process for the intake of the trip requests and the scheduling, we are seeing volume of trips increase substantially just because it takes less time on the front end. So there's been innovations, that Indra started and began with the beginning of the process, to just having the process and continuing to tweak that, and work with the other applications that we have and connect those applications, continues to be a priority for us. In addition to just the innovative concept of leveraging the driver networks that rideshare providers have.
Yeah, and I wanted to ask a follow-up about the technical side of things and the difficulties when it comes to, building up the databases and the APIs for this. How have you taken on those challenges? What were those challenges? And then how have you successfully solved them now that the program's, working on at the full enterprise level?
So, systems in the government is not the easiest thing to do, or work or deal with. And especially when you're dealing with PHI, as well. It adds another wrinkle. So, we've been working very closely with our privacy folks and our OINT partners, to streamline the process while protecting the veterans' information, yet also facilitating a veteran-centric process, right? So it seems like it takes longer sometimes than it should, but there are safeguards in place for good reasons, and we maintain strict standards for that. So, but at the same time as well, just with the emergence of the VA's use of APIs, the private sector and the ride shares have had their APIs out there for some time, which is a great thing. The challenging thing is getting those systems to connect and talk, and still maintain the government standards or the federal standards with regard to those PHI safeguards. And but we are making progress on that end. The other challenge is each of the at least the larger rideshare providers that have the biggest market share, they have their API, and that's the API for no matter who wants to use it. And we sometimes have some unique requirements on our side. So that does make it a little bit challenging to deal with, even though it's been very easy to design what should happen if we were both kind of out there in the free market and doing our things. We probably could be off and running already, but we're continuing to work with OINT. And again, that's kind of what happens being a leader out there in this kind of thought process, connecting and working to do public-private partnerships. When you have systems that are our systems that have veteran PHI information behind a federal, the government firewall, the VA firewall, and trying to use that and connect that to an outside system, it takes longer than hope. But in the end state, what it will really allow us to do is to the end state vision is to be able to have that information from the trip request that the veteran says, hey, I need a ride. We already know the address of where that appointment is scheduled. We know the residential address. The API can pop that information directly to the rideshare providers' APIs, and we can get an estimated cost and I'll say a reliability index or percentage, an expected probability to be able to fulfill that ride. And then our transportation coordinators on our side can have all the best of information from cost as well as reliability perspective to be able to schedule that ride and make sure the veteran gets where they need to go. So that continues to be our goal and our end state. because it'll provide us the most efficient way to do business from a cost perspective and timely delivery.
Indra, I wanted to ask a question of scale, understanding that, this was coming from a very small pilot program to something that's enterprise wide. How have you tackled that scale so that, we can get to the end state vision that Ben has just spoken about?
Yeah, Jordan. And you were talking about the API. Ben mentioned everything that it's not only one program office. You have to involve the OIT and a lot of other program office to create something very common platform where there will be a lot of integration. But by the end of the day, you are doing something which can be done at the same platform by integrating so many different mode of transportation. When we started in the pilot, it was only the uh, Uber Health dashboard because it was a pilot, so we don't have to do the integration as such from the API. And in that regard, the Uber Health is itself is a HIPAA compliant. It was not a Uber, it was a Uber Health. That was the only way we got the entrance into the VA to use the Uber Health because that is only specified to be used for the patient. So there was no PHI and PI which should be exposed. So that was the one of the thing which and like Ben said, when we were trying the pilot, then also we have to go through a lot of privacy, a lot of regulatory piece to make sure that we are doing everything which is supposed to be done. But the integration of the API was not there at that time. We were doing the pilot, so it was a dashboard of the Uber Health. Coming to your point about the scaling, because I'm in the innovation, and then this was, I can tell you, this is one of the biggest success in the innovation for any project which started from the idea and came to the point where the scaling is happening enterprise wide. And it was not possible at all if we have not included the program office on a first day. Recently, so many projects are coming, and when they come to me and they ask that, how can we reach out to the program office? I'm like, this is too late to include the program office. If you have to create something which will be scalable from the pilot or from the idea, on the very first day, you have to include the program office. So it's not on me because I'm not from the transportation. I never worked in the VTP. I worked very closely with Ben. But you have an idea and then you want to do something, go ahead, but make sure you have all your stakeholders on board thinking about how it will look in the future. Because the future of any idea or the pilot is the scalability and sustainability. If you cannot see the stakeholder who will be responsible for your scalability, you will not be successful. So that was the one thing when I started this idea from very first day when we were looking into it, Ben was on it, literally from the very first day. And at this time, he knows everything. Once the pilot was done, I wrapped it, concluded it, and they were ready to take it for the enterprise wide. I meet with them to get a little bit of abreast of that how it's going, everything, because it was my baby, but it's grown up now and they are taking care of that. So if Ben want to add anything, but for the scalability, you have to make sure on a very first step of your idea, you have to include the program office to make it happen.
Yeah, thanks, Indra. And I think the other thing that I think, in addition to the program office appreciating the collaboration up front, just so we can make sure, again, first and foremost, we have is to make sure on the regulatory and on the front end we're not creating a great process, but we're missing some big rules that we should not miss, and then we have to take a great process away, right? So I think that was critical, steps on the way in to do that. But I think the commitment to working with the stakeholders to execute it in the field while we were working in the background to optimize the systems were a really big part of why it was able to scale, is because we continued to make that commitment to work with the stakeholders to say, hey, this part of the process is too hard, let's do this. And in the pilot team, both on our side and the Uber side, we're continually committed to continually evolving the process and figuring out ways to make it more streamlined and executable at the site level, because ultimately that's where we have to get the buy-in from. And if they're not bought in on the process at that level, then the ability to scale it's not going to happen. So
Absolutely. And thinking about scale, I think I might have asked this, but I want to be sure. Could you tell me exactly where veterans are using this the most? Is it really like cities, rural areas, suburbs? Where are veterans finding the most use for a service like this?
I will give you some numbers and then Ben can talk more without numbers, a little bit more in detail. So there was a barrier, even when we started first day, because you can consider that Uber drivers, even if you are sitting in a rural area and going and using the rideshare service, it's not going to work because you will not get the drivers in the rural area. So that was our first challenge from a very first day. I don't think so. We have overcome completely on that, which Ben can talk a little bit that how the sites were able to allocate their resources so that they can make it happen. But the other piece which you asked that where it's used the max. So I have some data. The highest total number of the rides happened in Philadelphia. You can imagine it's a big city, followed by Tampa, where I am. Doesn't mean that I'm here, so that's why it's happening, but because it's very urban, it's very like you have like a huge network of a Uber, so you can get anytime. And when we added Lyft, it will be more, and then followed by Miami and Pittsburgh and Vegas. So those are the top five, which I can tell you that yes, those are the highly urban areas, which is there. But also think about that because these are very the area where we have a lot of the old population, and also the traffic is too much. So what we heard from the veterans from Tampa and Miami area is that they don't want to drive if they have veteran is more than 70-year old, even if he has a car, you don't want to drive in the evening in such a busy highway. And in that regard, he want to bring his caregiver. So that was another option that they can bring the caregiver. So it's not only because of the network is available there, but also the veteran population also depend in the urban area where they are used maximum. And also the longest distance which is travel with these rides is almost same. Miami is the one, followed by Tampa, Philadelphia, Pittsburgh, and Vegas. So those are the top five places which is using very, very highly. And I will let Ben to add there that which veteran population is using and why we cannot use it.
Jordan, I don't know if Indra cut out a little bit for you there at the end,
Yeah.
so I'll pick up with what I was able to catch of our question. But so yeah, Indra's right, and it I mean it's completely logical that the highest trip count is going to come in the more densely populated areas, as well as where the biggest network of drivers are for within the rideshare space. What I think is really important to note is even though that a lot of those municipalities where it's being used very often, sometimes those municipalities get pretty urban, pretty rural, pretty quick. So it also depends on how the facility is using it. I'll take Lexington for example. I mean, it's about 300,000 or 400,000 people. It's not a huge metropolis. It's kind of like a college town, and there's not a lot of rideshare providers to go originally pick up the veterans. So how Lexington's using the rideshare process is they're using our VTS service, which is our in-house. When a veteran says, "Hey, I need a ride," but they're out in a rural county, they'll use the VTS service to go get the veteran and bring them in. And then once they're at the facility in a more urban or suburban area, they'll be able to send them home on the ride share once they're done with their appointment. So they're able to put this again in their portfolio of transportation modalities. They're able to have it in there, still serve those veterans living in rural areas. It just may not be on both sides of the trip. So one of the biggest things I'm most excited about with I'll say our version 2.0 of our reporting dashboard is we're going to be able to have that rural urban split or those all the way down to the veteran. I'll say that the demographics of the veteran that was served on those rides, and be able to see, and really be able to demonstrate the impact as to how we're serving both the rural and the urban veterans with this kind of process.
Yeah, and it's really important to, to reach veterans wherever they are. And so I wanted to ask, understanding that, connection might not be great, might not be great. You only can oftentimes service the veteran on one side of the equation. How do you intend, I guess, going forward to hopefully get to a point where you can do both sides of the equation?
Yeah, I think so. Ben can talk more what we saw. So you can imagine we do have this ride share services in Topeka, Wichita, in Kansas City, which people cannot even imagine that they can do that there.
Hmm.
Because like Ben mentioned, it's the allocation of the resources. So we cannot ask the Uber to increase their network in the rural area, but over a period of time, as their market share is increasing, it is also giving a chance for them to increase their network. But there are two things which will be helpful for us also and moving forward also to even take care of the veterans who are in the rural area. One was when we were doing the pilot, it was the sites like Topeka or Wichita, the sites which are quite rural, were using allocating their resources for the like the buses and then the vans, which is provided by the VTP or the hospital to take the veterans for the rural population so that they can use the ride share for the people who are close by to the hospital. So that was one of the way we were able to even cover the rural population also. The other piece which Ben mentioned earlier also, and that's why I'm very happy for the enterprise wide, because it's now not only Uber Health, whatever 20%, 30% share is there in the market for the other ride share services, that can also be included in that. So now the chances of increasing the number of the chances of the rides to go far away is also going to increase because it's Uber Health and the Lyft. And we are hoping that one day maybe there will be a small business owned by a veteran who is only going to run this thing only in the rural area, because now they have a business which they can do it with the VA. So that's what is coming up. Recently, some people were saying that they might open in that arena also, which will be only focused for the rural, and we can even target that because VTP is creating that whole platform where every other business who is in the rideshare service can take the advantage of that, not only Uber Health and Lyft.
The other way, Jordan, that obviously we can't create driver networks where there aren't some, but one of the things that happened during the pilot too that I thought was really great is we were able to get heat maps from Uber Health that showed what zip codes they had, what volume of drivers available in. So it really helped us from a planning perspective, being able to help the facility transportation coordinator say, hey, if you've got a veteran that's out in this zip code, you know, it might not try this route if there because we already know there's no drivers, servicing zip codes anywhere near there. So that it's one of the things we're continuing to try and leverage technology, leverage the data that's available from the rideshare providers, and then combine that with the other service modalities that we have. For example, even part of what we're also doing on the other side of the vet ride equation is piloting um, I'll say the volunteer transportation networks like the DAVs and those types of groups, and plugging them into that whole vet ride ecosystem. So when we get a trip request that comes in, and maybe they're not eligible for ride share, that veteran's not eligible for the beneficiary travel ride share, we can automatically and electronically ping the DAV, offer them the ride, instead of and use the technology that we have with VetRide to offer them that ride. So that's another way that we're just using innovation technology um, to uh, serve veterans better, and make sure they get where they need to be on time.
And something, Ben, you mentioned at the start was that this whole process or program is designed to be vendor agnostic. I know we call it the Uber Health Connect program, but why is it important to, not only be so reliant on an Uber and bring in another competitor vendor like Lyft and even smaller rideshare companies that you mentioned?
Because there's inevitably going to be places that even the biggest providers don't serve. Aside from it being the law and being required that we do that, uh, it's just it's logical, and I mean, we did hold that vendor constant and did it as the pilot because we needed to see if the process could work and it could be executed properly. Once we figured out that it could, it's always been the plan of the agency, to offer as wide and broad for the more vendors that you have that can provide a service and provide the service well. Competition breeds efficiencies and continued progress in our ability to, again, have more service providers at our disposal to help veterans get where they need to go. Because that was historically a challenge, as Indra mentioned in her opening. We had a lot of veterans who couldn't get to their appointments on time. So we had a lot of missed appointments. We had rescheduled appointments and it was deferring healthcare, which in the end, cost the veterans, health, can cost the veterans their own well-being, but also can, cost more money for healthcare in the long run. So by, figuring out smarter ways and more efficient, innovative ways to do the transportation, we can make sure they get where they go. So it's always been part of continue to try and, eliminate the silos between the different modalities and efficiently schedule and deliver the benefit.
And understanding, this whole conversation has been a recap of the past year of the program as it, is now scaled out to the full enterprise. What are you both looking for the next year? What are some of the goals, hopes, dreams, desires of any kind that you have for the program now that it's really out there? Veterans are using it all over the country and able to take advantage of a program that's so useful and so helpful.
Yeah, I think so. Ben might have so many other things also in the transportation space. With this program, I think so. Like for the innovation, you start with one, and for me, the main thing was like it should be scalable. So yeah, for this program, I had that when I started this from the idea that how it can reach to each veteran wherever they need it, whenever they need it, using this program. Doesn't mean only the Uber Health. I think so. The main target for this program is to decrease the transportation barrier for our veterans, and that's what it is happening. Also, considering that it was with the Uber Health, it was a ride share, and now it is with all the ride share services. So basically, the goal remains same. That how we can reach out to the maximum number of the veterans so that they can come to their medical appointment, so that they can reduce the missed appointment, and that is going to have a very positive healthcare outcome on them. Seeing that that is happening, next maybe in 1 year, it will be available in all the VA. That is a big win for me. And I will not say only for me, but it's for the veterans, for the VA hospital, and for any innovation. So for me, moving forward, this I already hand over to the VTP. They are taking it enterprise-wide. But now we are working on exploring on the Uber RX, which is the 2-hour prescription delivery of the medication to the patients. And that we are working at this time with the program office of the National Emergency Management Program Office to see how we can pilot that. So hopefully by the end of this year, we are going to launch the pilot, and then we'll come back to you again, and then we'll talk about the Uber RX. But I will let Ben to talk about the future of this, and I'm very sure he's doing so many other innovation stuff in the transportation.
Yeah, no, thanks, Indra. And likewise, we have the same core, goals, right? Is get veterans to their appointments so they can, be present, not have to reschedule, and keep their healthcare appointments. That's the number one goal. The number 2 goal is reaching more veterans, right? So I mentioned, and Indra mentioned, and we didn't talk about it much in this podcast. We've covered it in previous ones, but this program is, just because of the way the laws work and the way our transportation authority works, only certain veterans are eligible for the rideshare process. So continuing to connect it with the other modalities that don't have those same eligibility requirements, like VTS or like the VTN providers that I mentioned, but also using the data that we get from how many trips that we can't provide, no matter what the modality, but especially even through rideshare. How do we use that data and the information about how many veterans were not able to get where they tell us they need a ride to change and and potentially change our regulations, work with Congress to change the laws because of the demonstrated need and the impact that it has, and using the data that we get from operations and how we've designed the process, all will contribute to helping us ultimately have a more efficient, not just efficient, but more efficient program overall to meet where our goals as a VA is all about access. And if having good data on how many trips we're having to decline where veterans say they need a ride is critical to being able to craft good programs. And sometimes that takes legislative and regulatory changes, but that's not something we've been scared to try and tackle in the past, and are willing to do as support. So we use the data. I really want to continue to use the data to make to present opportunities for VHA and VA leadership to make good decisions on things that we pursue as it pertains to transportation and getting veterans to their appointments.
Absolutely. Well, I just wanted to thank you both for taking the time out to share about the rollout, and hopefully, all that we are hoping will come to pass in the next year does, and we can circle back and, talk about the new developments in the program and how it's working even better for veterans. So thank you both for joining me.
Thanks, Jordan. Have a great weekend.
Thank you, Jordan, and thank you, Ben.
All right.